So we've talked about a few key dietary strategies where there's clear evidence that they can work for our patients, and lots of other diets where there's almost no evidence at all. But are there any dietary strategies where there's clear evidence that they may be the wrong thing for our patients with type 2 diabetes to try?
This will come as a surprise to most people, but our view about low glycemic index or low GI diets has changed over the past few years. The first few studies suggested they were very effective for improving glycemic control, but more recent data shows that they only have a modest effect in reducing hemoglobin A1c, so only by about 2 millimoles per mole, and they have little or no effect on weight. So we have studies here where the evidence shows that these diets are really not that effective for people with type 2 diabetes. Diabetes UK recommend that low GI diets can be used for fine-tuning to improve glycemic control, but they're no longer considered a primary strategy for people with type 2 diabetes.
It doesn't seem that long since GI diets were what were being recommended everywhere. I think it can all seem a bit confusing and people could be forgiven for feeling like that. Are there any other key diets where the information or advice has really changed?
Certainly, if we look at carbohydrate intake for people with diabetes, the advice there is always changing over the years. So initially, it was seen as a disease of carbohydrate metabolism, so carbohydrate was restricted. We then went on to carbohydrate counting when insulin was first introduced. Then in the 70s and 80s, we moved to a high fibre, high carbohydrate diet, and it seems to have come full circle now. So carbohydrate management and some restriction is recommended. The restriction of carbohydrate concentrates on things like sugary foods and refined or processed carbohydrate. But it seems to have come full circle, and certainly the advice does change over time.
Thanks for that overview, Pam. I must admit it can seem a bit challenging to manage to keep up to date with the best dietary guidance that we could be giving our patients. Are there any resources that you would recommend for healthcare professionals who wants to keep up to date with the latest recommendations about where we can be directing our patients for up-to-date information?
Well, because nutrition is a relatively young science, then as new evidence emerges, then recommendations will be changed. So we would recommend that you visit either the NHS website or Diabetes UK. They publish nutritional recommendations for people with diabetes, which is a document that's updated regularly, and also as new evidence comes along, they produce position statements. So visiting those websites can be a useful resource for people who want to stay updated about dietary strategies for people with type 2 diabetes.